Welcome, everyone. I am here today with Dr. Bill Osmunson, who's on my right, and he is a leader in the fluoride opposition movement. He's been a full-time dentist for over 30 years in the Pacific Northwest, and in addition to dentistry, he has two interesting other characteristics which you wouldn't necessarily know. He has a master's in public health, or an MPH, which particularly suits him for this topic because he really has a credentialed degree in public health, and that's really a significant component for how fluoride impacts our culture. But in addition to that, he has an interesting history. He's an MK. And for those of you who don't know what MK is, he's a missionary kid. In other words, his parents were missionaries in Africa, and he grew up in Africa, I believe in Kenya, at least part of the time. And so he's got another interesting perspective and seeing life from a different perspective than most of us have had the opportunity to do. So today we're going to focus on fluoride, its impact, and some of the research he's been doing to really come to a solution to remove it from our water supply at a different level than we're positioning, but I think it's a really effective one. And he's come up with some really surprising and solid information that you need to know because of some of the initiatives that we're going to be establishing this year, and that allow you to become involved in a local community group. And we'll talk a little bit more about that later in the conversation. But welcome, Bill.
Thank you very much. Nice to be here with you.
So why don't you, I think most people viewing this understand that fluoride is believed to be useful to protect against dental caries.
I promoted fluoridation for 25 years, and over the last about 5 to 8 years, it was really under the coaching of my patients. Said, Bill, you need to look at the science on fluoridation once again. One of the first things I did, of course, I gave out lots of free toothpaste. I started reading the label on it, and keep out of the reach of children under 6 years of age. Okay, that sounds reasonable. And adults apply a pea-size amount, and contact the poison control center if you swallow. Hang on a second, hang on. How much is, so I just took off the lid. I started doing pea-size amounts, put it all on a piece of paper, calculated out what it was, and oh my goodness, a pea-size amount. Now they're talking about a baby pea, because I did a regular pea and I came up with half as much. But what they're talking about is you can probably see it on here. Oh, that's too much. That's about the pea size that should be used. A tiny, tiny baby pea size of toothpaste, because you're supposed to get 150 brushings out of something like this. One tube of toothpaste should last a person several years. And how much is in there?
What do they think they're typically doing, like 2 months or a month?
Oh, well, you know, when you see advertisements of it, you're going to see it, and they're going to have it like this, and then they're going, oh, you get that Dairy Queen little curl up at the top there. Ooh, now I've got my Dairy Queen ice cream cone. But that's nothing like what you're supposed to be doing. That's not.
That's a week's or a month's worth of dose, right? Isn't it?
No, more than that.
That's more than a month?
More than a month. Oh, absolutely.
Yeah, let's get a photo on this. This is more than a month. The one they use for marketing illustrative purposes is more than a month's worth of toothpaste that you're supposed to use according to the label instructions. And if you don't believe us, read your toothpaste or go to the store. If you're smart enough to not have this in your house, go to the store and read it.
Yeah, it's absolutely. Now, the FDA permits variable wording, but that's basically what's there. Well, that in the research literature works out to 1/4 milligram of fluoride. This water here happens to be Chicago water out of the faucet. This contains 1/4 milligram of fluoride. There seems to be a disconnect with me there. Okay, they tell me not to swallow 1/4 milligram of fluoride in my toothpaste, but they're forcing me to swallow 1/4 milligram in 1 glass of water. Why is the government all messed up? Why is there such conflict? Well, I mean, that's my job. I'm a dentist. I'm supposed to know these kinds of things, and I didn't. Just a couple days ago, I was reading how there was a study where they took a drop of fluoride at 10 parts per million. This has 1 part per million, so 10 times stronger, and they put it under the tongue of a mouse, and they were able to measure the attention deficit reduction of the mouse. Now, this here has 1,000 parts per million, 100 times as much as what they put under the tongue of the mouse. Okay?
100 times.
100 times as much.
That's 2 orders of magnitude. 100 times.
It's unbelievable. So we know that we're getting some neurologic damage at very low levels. However, the latest research is even worse than that. We're finding an 8-point IQ drop in when the blood level, serum blood level, goes from 0.04 to 0.08. So in other words, when the fluoride level doubles in the blood serum, that's the level at where we're finding about an 8-point IQ drop. Fluoride is very toxic, more toxic than lead. And of course, lead, we don't want lead in our body because it causes brain damage also. Now, let's put this in perspective a little bit more. The American Dental Association recommends that a woman have about 3 milligrams per kilogram, 3 milligrams per day of fluoride as optimal, and men about 4 milligrams per kilogram is optimal.
No, per day.
Per day. That is the same amount that causes between a 0.8 and a 0.12 level of fluoride in the blood. The same as it's showing 8 IQ point drop.
And where was this study done? Was this in,
Well,
when was it
this is
published?
very interesting. You see, in the United States, we don't do much studies on the adverse effects of fluoride because we're promoting it so much. The CDC, everybody promotes it so much that they don't want to find out that we're really having a problem. This study was done by the Center for Disease Control in China. You see, in China, they don't allow fluoride to be put into the water because it's too toxic and it causes damage. And so what they do is they take their waste product of their phosphate fertilizer industry and they ship it to the United States.
Which is fluoride. That's where most of the fluoride is taken.
There you go. And so we drink what they won't allow in there. Now, if you took that same fluoride...
So are we using theirs? We're using theirs because of the cost, or do we...
We're using it because we don't make enough.
Well, we don't make it. So we're using ours that we produce
We use all
in
of
the
ours.
US, and we import the industrial waste from China to put into our water.
Correct.
That's interesting.
Because we're so tough, we can drink what they won't allow in their water. Mm-hmm. Anyway, and not only that, but it's contaminated. Ours is and theirs is with lead and arsenic and radium, radionucleotides and aluminum and all kinds of things in it because it's not a pharmaceutical grade what's put into the water. So this area of brain damage is so staggering to me that it's hard for me to gasp for air at times. This latest research was published by our National Institute of Health here in the United States.
NIH, which is
NIH.
about as prestigious as you can get for a certifying authority in publishing research.
Absolutely. And it was done by their Center for Disease Control along with the Shanghai University. The research is very, very good quality. Rarely have we done a blood serum study on fluoride and what it does and what the IQ is and the relationship there. So in this aspect, I'm not saying that everything out of China is great. I'm just saying in this aspect, their health departments have actually done research where ours have failed to do it. So one of the concerns I have is the brain. I mean, our brain is the economic impact of brain damage. We're looking at about $500 to $1,000 per year less income for every IQ point that is dropped. When you know
it's a powerful point. I just want to emphasize that $1,000 a year income for every IQ point.
Yes.
And you know, this is kind of not a really great economy right now. So that's going to start to add up pretty quickly.
Dentists fix teeth. Mm-hmm. No one fixes IQ. This is an irreparable, irreversible damage that's happening to our public. When we compare the states in the United States, 50 states in the United States, ranking them on the percentage of the population fluoridated, Utah was lower, Idaho was lower, Oregon is lower, Hawaii is lower, several other states are lower, and then you just get this graph going on up to where some of them are virtually most everyone is fluoridated. We find that there's a tripling of mental retardation in the states that are more highly fluoridated, like Illinois.
Wow.
Yeah. And really, seriously, if you really want fluoride Just swallow a pea size of fluoride toothpaste and you've got the fluoride. We've got it all over the place. It's not like you can't get it somewhere else. Tell people if you want fluoride, swallow a bit of your toothpaste. Disobey the FDA, and then you've got it. But don't mass medicate everybody else for it. So I'm highly opposed to fluoridation. And then it gravitated me on over, and we could talk about the bones, we could talk about fractures, we can talk about the pineal gland just below the brain. What about teeth? What has not been looked at is the risks to the teeth, because we all agree, there's no dispute on this by anyone that I know of, that too much fluoride can cause dental fluorosis and skeletal fluorosis, but dental fluorosis. Dental fluorosis is shown by little white spots in the teeth, brown spots in the teeth, this type of thing. And if it's just on one tooth and not any other teeth, then it may not be the fluoride. So it should be similar teeth that are developing at similar times, and then that would be the fluoride. Well,
Can you only get this as a developing adolescent, or can an adult get it?
only while the tooth is developing inside the bones. So the National Research Council says that fluoride is not beneficial after the age of 8 because our teeth have finished forming. Before the age of about 1, mother's milk has virtually no fluoride in it, and so we shouldn't have it before about the age of 1. We shouldn't have it after the age of 8. So we give fluoride in the community for everybody in the hopes that maybe the children between the ages of 1 and 8 will have a benefit.
So for a 7-year window, and this is accepted, there's an organization that says it is
National Research Council,
which is the
highest
top,
scientific
body
organization
in the
we have.
United States,
They're-
is on record as saying there is no benefit for someone who's older than 8 to get that.
Correct.
Yet, it's in 2/3 of our water supply.
Exactly.
That's profound
And
stupidity.
we only drink less than 1% of the water that's fluoridated. And so if on balance, we had some cosmetic damage and we were helping to prevent the little kids from having decay, I could weigh that in my mind and say, on balance, okay, there's risks, there's plus, there are minuses. But for one thing, that should be the patient's choice, parents' choice. It shouldn't be forced on people. Second thing, it's not reducing the decay any or hardly any for most people.
We're both a firm believer in freedom, and anyone should have the opportunity and freedom to choose using fluoride in their child. But I
Yes.
think you presented some very compelling evidence, we certainly provide others on the site, that there is no benefit to doing this. So,
There
I mean, you
isn't.
don't
Do it.
don't have them swallow it, I mean, clearly, but don't have them use the fluoride toothpaste, then you don't have to worry about this issue. But for whatever reason, if you choose to believe that this isn't true, then, and you're using fluoride toothpaste, first use 1/30 this amount and make sure they don't swallow it.
Or contact me for more, bill@teachingsmiles.com, and I'll give you more scientific information. But you're absolutely right. We just cannot be swallowing this stuff. The National Institute of Health had a symposium conference on preventing dental decay. And one of the slides in the PowerPoint presentation was very clear that the evidence was incomplete on all forms of preventing decay except fluoride varnish in 2 specific situations. One was in rampant decay and the other was in radiation decay. So in 2 specific instances where people were eating absolutely terrible food, drinking a ton of soda pop, damaging their bodies in many different ways, or they were having radiation for cancer to their mouths, that the fluoride varnish had fair evidence of benefit. In all other cases, it was
the varnish
incomplete.
is a topical application, not systemic like water at all.
I would never allow my dentist to put a topical application of fluoride on my teeth or any of my children or my grandchildren.
And obviously would never recommend it to anyone viewing this.
Absolutely not. No, it's going to save you money, but it's that, not only that. I have offered the insurance companies that if I would work for them at no charge if they only give me a very small percentage of the money I save them. And they've refused because they know that I'm going to say no fluoride topical treatments because it's not showing benefit. Statistically, the science doesn't show that it's beneficial.